Hey everybody, Dr. Osborne here. Today I want to expose heartburn myths. Most people get diagnosed with heartburn by a GI doctor where they go in and have an upper GI or a scope and they find levels of inflammation either in the stomach or in the esophagus. And so right away the doctor's thinking you have heartburn and telling you this problem is caused by too much acid production. And most of the time that's absolutely not true. Let's talk about why. If we look at the stomach, so up here is your esophagus, and then we have the stomach, and then we start down here with the small intestines. So the stomach is lined by a layer of cells. Actually, more than one type of cell, but for the intention of this video, we're going to talk predominantly about a type of cell called a parietal cell. Now, the job of parietal cells is to produce HCl. HCl is acid, hydrochloric acid, or otherwise known as stomach acid. Now, these cells that we've got here lining the stomach, imagine it's lined all the way through, produce that acid, and then it's the job of that acid to help several different things. So what does acid do? It helps you to digest your food, obviously, but predominantly meat and protein are very important for stomach acid to help with. It helps you to absorb vitamins and minerals. So as an example, vitamin B12 requires stomach acid, calcium and magnesium require stomach acid to be able to be absorbed properly. And then number three, the stomach acid serves as a mechanism or barrier to defend your lower GI tract from bad bugs. When you eat food, there are all different types of virus, bacteria, yeast, and other things within that food. The stomach acid is designed to help neutralize these potential bad bugs so they can't go down deeper in your intestine and colonize your intestine, creating problems. So stomach acid has a lot of important roles. Now, going back to if you've been diagnosed with heartburn or acid reflux, the theory is that you're making too much acid. In other words, these cells are overproducing acid, and that somehow by that overproduction, they're creating damage and inflammation to the stomach or esophagus. But like I said, for most people, this is not at all what's happening. Now let's add a little bit more to this image. So on the surface of these cells, there's a lining or a layer, if you will, of mucus that's produced. It's oftentimes referred to as mucin. And so this mucus, if you will, serves as a protection or as a coat that lines those cells so that food that's coming through is less potential possibility to damage these cells. Remember, there are bad bugs in your food. And this is even if you're eating whole, clean food and organic food. So there can be bad things when you eat. The job of your stomach is to help begin the process of separating those bad things from good things for digestion and absorption. But anyway, we've got this layer of mucus that's very, very protective. And so one of the things that happens is this mucus barrier becomes damaged. So we get damage to the mucus barrier, and when this mucus barrier is damaged, when we have areas where that mucus is eroded, then we have these parietal cells are now being exposed. They're being exposed. So remember, they're producing acid already, but now that HCl is somewhat bounces off, it's neutralized by that mucus layer, but if it is allowed to penetrate and permeate into the cell, now we can get damage to these cells, and that damage creates inflammation. Okay, and so now we have this scenario where the stomach lining begins to become inflamed, and then food is coming through, right? And then the food itself, the very act of eating, because this area is already damaged, the very act of eating irritates it further. It's like pouring alcohol on a scab. Think of this as a scab of the lining of your stomach, and that food is just one more thing that's creating an irritation. And so what happens in this scenario for most people, if they have that diagnosis, is what does the doctor do? The first thing the doctor does is they prescribe antacids. You know, PPIs, proton pump inhibitors, drugs like omeprazole or Nexium. These are classic examples of medicines that suppress the production of hydrochloric acid. So they alter that and lower it in an effort to reduce the irritation, because remember, once you have an area exposed, the acid can damage it. So by lowering the acid, they're reducing the symptoms, but still, in all, the problem is still not that the person is making too much acid. The problem is that there's damage to the lining. So why do we want to know that? Because if you're put on these medications, we come back over here. What is the job of the stomach acid? It's to help you digest your protein. It's to help you absorb vitamins and minerals. It's to help you prevent bad bugs from setting up shop in your lower intestine, creating problems. So consequently, when we are taking these medicines for long periods of time, our protein levels and our capacity to break down and digest our protein becomes altered. Well, what are the side effects of that? If we really want to look at, problems long term, what are the really big long-term side effects of stopping protein digestion? Well, number one is we develop issues with our muscles, our ability to make antibodies, our ability to repair damaged tissue, because your body needs protein to do these things. Your body needs protein to make and restore and maintain muscles. Proteins are used to make antibodies. Antibodies are what we use to fight against colds and flus and other types of infections. And repair, just the daily maintenance and repair of the body. You need protein for that body repair. So fast forward 6 months being on this type of medication, these types of problems start to set in. Now, we throw in this next component here, which is a reduction in vitamin and mineral absorption. And so we're just use here in this example, we'll use magnesium as the example, because magnesium deficiency has actually been very well studied in patients been given these types of medications. So we got low magnesium. Well, what does low magnesium cause? Well, low magnesium causes muscles to spasm. So we can get spasm. Low magnesium can increase constipation. Remember, your GI tract is a tube that is muscle, and so low levels of magnesium can cause the GI tract to become constipated. Low magnesium can cause energy issues, fatigue, poor sleep. So, we need magnesium for our brain to be able to fall asleep. It's a natural relaxing agent. We need magnesium. There are several hundred different enzymatic functions. There's suspected to be 1,000+ functions for magnesium in the human body. Magnesium deficiency has been linked to high blood sugar. Magnesium deficiency has been linked to diabetes and heart disease. So, obviously we don't want to have a magnesium deficiency being caused as a result of long-term use of this medication. So again, this is just one example. We're not even going to go through B12 or calcium or zinc or other nutrients that need acid to be properly absorbed. But you get my point, you get my meaning. We also lower our resistance to bad bugs when we're on these medications for long periods of time. Now remember what I said earlier, is that protein is necessary for your immune system to produce antibodies. So now, with that reduction in antibody production, how are you going to defend yourself from these bugs? One, you've wiped out your acid, so you can no longer really kill the bugs with the acid. So what's left is the other aspect of your immune system, which for many people is their antibody capacity, the production of antibodies to neutralize. So again, the stomach acid inhibitors stop the acid, stop the antibody formation, or at least reduce it to a level that it causes an immune problem. And so now you're at an increased risk for developing GI tract infections, among other things. So not something that you really want to have. So again, we're going back to why, right? So you get the diagnosis of heartburn, and automatically they jump to stopping your acid production. But what we really want to know is right here. What is causing the damage? This is the most important thing to understand. So there are different things that cause GI tract or stomach parietal cell damage and mucosal lining damage that are very, very common. Let's talk about what those things are. Number one is food. Now, very commonly we'll see Gluten plays a major role in acid reflux symptoms or heartburn symptoms. But there are other foods that can also do it, but gluten, very, very common. There's a lot of medical literature actually showing people with acid reflux and GI gastritis and inflammation do very, very well going on a gluten-free diet. But again, dairy can do this, proteins in dairy. Sugar obviously is not something that you want to consume. And then beyond just the kind of common sense stuff, there are specifically unique individuals will have unique and different reactions to different foods and different food proteins. Again, gluten just being one of the more common. So gluten is a major driver of this, and so we'd want to know about that, because diet change is a very simple thing to do. Now many of you maybe don't know what gluten is or haven't attempted a gluten-free diet, or maybe you're paralyzed because you think gluten isn't everything. And if that's you, if you're new to the gluten-free diet, we'll put a link below this video. You go check out some of our master guides on gluten and maybe get a kickstart or a head start on how to go gluten-free properly. But again, big one here. So number 2 is what's a lot of times in the food. Chemicals, food additives, food dyes, pesticide residues, etc. These things are notorious for creating damage to that mucosal lining in your stomach. And so if you're eating a lot of those things, if you're eating a lot of processed food, if you're eating a lot of foods that contain, dyes and other additives, it's something that you may want to look at correcting. Number 3 is medication. Now, beyond even heartburn medications, so we said before that heartburn or PPIs or acid-reducing medications will stop the acid production, leading to a slew or a plethora of different types of problems over here. But some medications can also damage the lining of the stomach as well. And one of the most common is a class of drugs called non-steroidal anti-inflammatory drugs. So these are drugs like ibuprofen, naproxen, Celebrex, commonly prescribed medications, and many of them are also over-the-counter. Aspirin falls in this category. As a matter of fact, 1/10 of the dose of a baby aspirin, which is about 7.5 milligrams, is enough to cause erosions to this mucus lining and to damage it. So it doesn't take much, and where a lot of people struggle is they have chronic pain, so they're taking these types of medications on a regular basis, and it causes these erosions in the stomach lining, which again can start this damage and start this cascade off. So be aware, if you're taking those drugs, especially if you're using them on a regular basis, you really want to be concerned that you're damaging the mucosal lining of your stomach. Steroids can also do this. So something else to be aware of. So these are both pain medications, but generally speaking, it's far more common for people to be on NSAIDs because a lot of them are over the counter and it's a lot easier to access them. So medications can cause that damage. And then number 4, gut bugs. So this, again, we're coming full circle here. I said before that taking an antacid would reduce the ability to protect yourself from bugs, and then that bugs were actually one of the triggers or causes to the damage. There's a specific type of bacteria that's been very well studied, and a lot of doctors actually will measure for this. It's called Helicobacter pylori, or H. pylori. This type of bacteria can drill through the mucosal lining in the stomach and damage the cells underneath. And so again, if you are exposed to H. pylori while taking antacids, the risk of that H. pylori colonizing your stomach at a much greater extent is greater because of the side effects of those particular medications. So you want to be aware of that. So if you've got acid reflux, again, the likelihood that you're making too much acid is very, very small. I've actually never encountered a person that made too much acid. The general rule of thumb is most people make not enough acid. The reason why is these cells are becoming damaged through these mechanisms. And so then when again, just like when you're taking an antacid, if you're not making enough acid, these same types of symptoms and side effects can also occur. So if these are the things that can cause the damage, what do we do about it? Well, let's talk about that now. So number 1, we change our diet. So diet change is a very simple tool and a very powerful tool to overcome the irritations in the GI tract. Number two, a lot of times as well, is we fast. So doing a fast, particularly a water fast, works very well. 24 hours is a good time frame to make that attempt with. But a fast is a very safe and a very easy thing that most people are capable of doing. And remember that this lining of this GI tract, the stomach lining, heals extremely quickly. So if it's already irritated, cutting food out for 24 hours allows a break and allows relief to a certain extent. The cells and that mucus layer can start healing even within 24 hours. Remember, the lining of these cells heals and replicates every about 2 to 7 days. So it can heal very, very quickly. And fasting can be a valuable tool or a valuable asset in your arsenal of natural treatment options. Number three, you can coat the lining. And there are some natural things that you can coat the lining with. These products, as a general rule, they're called mucilaginous products. And so examples would be aloe. Most of you in the South have an aloe vera plant maybe on your porch. If you break it open, it has a gel inside. Well, that gel is a mucilaginous that coats and lines the stomach and intestines. So aloe is one that can be used. Marshmallow root is another one, and not the marshmallows you buy at the store with all the sugar. I'm talking about marshmallow root specifically. DGL is another one. Deglycerinized licorice can coat or help line the GI tract. L-glutamine, which is an amino acid that helps to support the replication of new cells and help support the healing or recovery of the GI tract. So these are all different types of either food-based products or supplemental products that you could use, again, to just provide a coating around the lining. Because what we want to do is we want to kind of artificially re-emulate this mucus and put something down so that we're protecting those damaged cells while those cells are healing and producing a new layer of mucus, to form to basically allow this area to be healed again. And so these mucilaginous products aren't going to necessarily heal the damage, but they are going to provide a temporary layer of protection between anything coming through, any kind of irritant coming through that could irritate that already damaged area. So again, coat and line that GI tract. Now, a lot of people also find tremendous benefit using probiotics. So we'll put number 4 up here. A good probiotic can be very helpful. There are a number of studies show that people taking probiotics reduce their heartburn symptoms or their gastric reflux symptoms. We especially see this true in the gluten literature where probiotics can actually reduce these symptoms that are caused by gluten. So when gluten does this damage, probiotics can be a very helpful and effective tool to use to help recover that damage. And then number 5, we said over here, chemicals, additives, dyes, pesticides, and different food allergens were all triggers. Number 5 kind of brings that together. So number 5, which is diet change, basically means to eat real food. And a lot of you, sodas and processed foods and junk foods, again, let's avoid these different chemical irritants by eating real whole foods. So that's, meats, vegetables, nuts, fruits that don't have the dyes, preservatives, and other things in them. You can still get good, healthy, good tasting food in this category without damaging or irritating the lining of the stomach. And so in summary, if you've been diagnosed with acid reflux or heartburn, I want you to understand that the vast majority of those diagnoses are actually damage or irritation to the lining of the GI tract caused by these 4 things, and not because you're overproducing stomach acid. So solving it by trying to repress or suppress your body's ability to make acid will come with the consequence of multiple different problems, including low protein, vitamin and mineral malabsorption, as well as increasing your risk for developing or picking up infections or gut bugs. Again, one of the causes of the problem. So again, if you've been diagnosed, maybe have this conversation with your diagnosing doctor and make some changes in your behavior, and you'll find that the problem can be resolved without the need for tons of medications.